Hello and welcome, everyone. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleagues Nikki, Thalia, and Melissa, who will be presenting today's information. Together, we are here to share information about the Health Connector's open enrollment and walk you through some of the helpful tools available. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we just want to share some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout, and I will note that we do have a large crowd, so feel free to scroll through and see if your question has already been answered. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. Lastly, at the end of the webinar, we kindly ask that you stay on and complete a survey, a short survey that'll help us improve future sessions and inform those sessions. Now, with that said, we can get started, and I'll hand it over to Thalia to kick us off.
So hello, welcome everyone. Thank you for joining us today. In our presentation today, we'll give a brief overview of the Health Connector, enrollment periods and their deadlines, how to apply and update your application, updates and eligibility for our ConnectorCare coverage, how to save on your monthly premium, and where to get help applying for coverage and other resources that are available to help you select the right plan for you. So just a quick overview of the Health Connector and who we serve. We are the state's health insurance marketplace for individuals, families, and small businesses, and we provide access to affordable health insurance. Those who shop for coverage with the Health Connector are usually those who can't get insurance through their job, their spouse's job, or if you have a part-time job that does not provide health insurance to their employees. The focus of our presentation today will be health insurance for individuals and families, but we do also provide dental insurance, and some of the plans available through the Health Connector have limited vision benefits, but members should reach out to carriers directly to see what is actually covered. Also available through the Health Connector is Health Connector for Business, where small employers can shop for health and dental coverage for their employees. Today's presentation will not cover any details on Health Connector for Business, but if you are interested, we have a separate webinar on this topic. So when shopping through the Health Connector, you can be assured that all plans meet state and federal standards for coverage. When applying for insurance through the Health Connector, you'll choose from a variety of plans based on the area where you live. And because the Health Connector is the state's marketplace, we have benefits and programs that can help to reduce your monthly premiums. We have advanced premium tax credits, which we'll go over in more detail later in the presentation. And we also have our ConnectorCare plans that are unique to Massachusetts and is based on individuals or families' income level. Those eligible for a ConnectorCare plan may qualify for low or no cost health insurance, and we'll also talk about ConnectorCare plans in more detail later in the presentation. Okay. So on this slide, you'll see health insurance companies in Massachusetts that offer plans through the Health Connector. All insurance companies who participate in the Health Connector also offer plans in our ConnectorCare program, which means more plan options for Massachusetts residents. In this slide, you'll also see the dental carriers that offer plans through the Health Connector. If you have health insurance elsewhere and are just interested in dental coverage, you can purchase plans for yourself or your family through the Health Connector as well. Okay. So there are two important timeframes to keep in mind when applying for health coverage. Our closed enrollment period, where you'll need a qualifying life event to apply for coverage through the Health Connector, and our open enrollment period, which is currently happening. So during open enrollment, new and existing members can apply for new coverage or renew their coverage through the Health Connector. Open enrollment for plans that will begin in 2026 will begin on November 1st and will run up until January 23rd. During this time, you will have the opportunity to review the plans available on the Health Connector for coverage that will begin on January 1st. Existing Health Connector members will have the opportunity to review these plans as well as select a new plan if you would like. Health Connector coverage will always begin on the 1st of each month. So for anyone seeking coverage that will start on January 1st, you must select a plan and make that payment by December 23rd. Okay. So we often get questions about COBRA, so I wanted to take a few minutes to discuss the Health Connector as an alternative health coverage option. If you are without coverage at the moment or are enrolled in COBRA coverage, now is the perfect time to switch over to the Health Connector for a plan that might be more affordable. Usually, if you are enrolled in COBRA coverage outside of our open enrollment period, you would need to remain in that COBRA coverage until you have a qualifying life event, your employer stopped contributing to your COBRA coverage, or an upcoming open enrollment period. So this information is not relevant at the moment because we are in our open enrollment period, and anyone seeking coverage right now is encouraged to come and apply and explore their options. Okay. So you can apply for coverage on our website at mahealthconnector.org. The application is available in English, Spanish, and Portuguese, if that is your preferred language. The Health Connector and Mass Health use a single application to determine which coverage you might be eligible for. So you do not need to know if you are applying for Mass Health or the Health Connector, as the system will make that determination once you enter all of your information. And if you have filled out an application with us before, please do not make a new account. Instead, call customer service and they will help you access your account. So as I previously mentioned, both new and existing members can shop for coverage that will begin on January 1st, but the process might be slightly different depending if you are an existing member or are a new member. So we'll start with existing members. Our existing members already getting coverage through the Health Connector do not need to complete a new application. You just have to log into your account and make any necessary updates, including changes to your income or changes to your household size. You'll then review your eligibility and provide any document proof if there is any requested from you. And then you'll have 90 days to submit these documents. And then lastly, you will select a plan, pay your premium if you owe one by the 23rd of December, and your plan will start on January 1st. So if you choose to continue with your same plan, you'll pay your same premium. Or if you choose to pick a new plan with a higher premium or a lower premium, you will then pay that new premium on December 23rd. So for newly applying members, the only difference here is that you must complete a new application. You may also be required to provide document proofs, and you'll also have to make a payment by December 23rd for your coverage to start on January 1st. Okay. So there are a few qualifications you must meet to get coverage through the Health Connector. You must live in Massachusetts. You must be a U.S. citizen or be lawfully present in the United States. You cannot have or be offered health insurance through an employer, and you cannot have public health coverage like Mass Health or Medicare. So for our newly applying members, when applying for coverage, you'll need the following information. You'll need your social security number and a social security number for anyone who is applying, immigration documents, and income information, including copies of your pay stub, net income for those who are self-employed, and monetary determination if you are receiving unemployment. And if you don't have all of this information at the time of application, that's all right. Just provide us with the information that you do have, and we will follow up requesting more information if we need it. So one of the questions that we often get is what income should be included when reporting on your application. On this slide, you'll see what sources should be included and those that should not be included. The information is also available on our website if you would like to review it. So you will receive these slides and you'll be able to click the link on this slide. And additionally, it's important to keep your income and application up to date to make sure that you get the right amount to help pay for your coverage and lower the risk of owing money to the IRS at the end of the year when you're filing your taxes. And you can log in at any time and update your income information, not just at the time of completing your application. So after submitting your application, we ask that you check your mail from the Health Connector as well as Mass Health to make sure that there is no additional information that is being requested from you. Any documents you owe can be submitted online through our website within a 90-day time frame. And I'll say this again, please make sure to update your application if there are any changes to make sure that you and your families will get the right amount of help paying for your health and dental insurance. And now I will pass it off to Nikki to talk about our ConnectorCare program.
Thanks so much, Lilia, and thank you everyone for joining us today. We know there's lots of interest as we are in the Health Connectors Open Enrollment period. So I just want to talk a little bit about some of the changes that you may be hearing about, and specifically think about the types of payment support that is still available through the Massachusetts Health Connector, and specifically through advanced premium tax credits, as well as the ConnectorCare program. So as Leah explained, we are the state's health insurance marketplace. So we are the only place where individuals can apply for and see if they qualify for federal advanced premium tax credits. So these tax credits lower the premium amount you pay each month, and the IRS is going to send the tax credit directly to the insurance company. So as a consumer, all you'll be doing is paying less each month if you qualify for APTCs. Now, as a consumer, if you are in a situation where perhaps your income fluctuates up or down, and you're seeing that you qualify for a certain dollar amount in tax credits, you can choose to apply all of those tax credits, or you can reduce the amount that you want to apply. If you want to essentially be sure and prepare so that you don't have any unexpected debt at the end of tax filing season. Now, as Belia said, unique to Massachusetts, we have the ConnectorCare program. And this is our state program that combines federal advanced premium tax credits plus additional state dollars. And together, that's how the monthly premium amounts are reduced. So people who are eligible for ConnectorCare have lower monthly premiums, low out-of-pocket costs, and no deductibles in the health insurance plans that they enroll in. Now, there have been some program policy changes that have happened. So particularly, there have been some federal policy changes that have had two major impacts to the ConnectorCare program beginning in January of 2026. I want to stress that there are no changes to the ConnectorCare program for the remainder of 2025, but these changes will take effect on January 1. I'm going to show you some slides in a few moments that talk about our specific plan types and also cover federal poverty level. So some of this may not 100% make sense right now, but I'm hoping as I show you the tables and you listen to this. So I guess I'm asking you to hold on with me, stay with me for a moment over these next few slides, so that you have a better understanding of what plan types will be going away, but still what plan types will be here in 2026. So ConnectorCare Plan Type 1 is being eliminated. So that means people with incomes under 100% of the federal poverty level will no longer be eligible for advanced premium tax credits beginning on January 1st, which essentially means they can no longer access ConnectorCare. In addition to that, ConnectorCare Plan Type 3D will also be eliminated. Because ConnectorCare eligibility includes a requirement that people must also be eligible for advanced premium tax credits, there has been recent conversations in the media about federal enhanced premium tax credits, which are set to expire in 2025. With that in mind, and if these enhanced advanced premium tax credits don't continue, APTCs will only be available for individuals earning up to 400% of the federal poverty level. So essentially, that means plan type 3D is going to be eliminated as well. So if anybody wants to learn more about the specific federal changes and stay informed, as people are aware, things could shift as we're in the middle of a federal shutdown. However, as of right now, this is how we are proceeding and what we're expecting for January 1. So we have a webpage dedicated to federal updates on our site. If you go to mahealthconnector.org/updates, you'll be able to link directly to that page. So let's look at income limits using numbers versus at federal poverty level figures. So right now for 2025, the ConnectorCare income limit for an individual is $75,300. So that means through the end of this year, if someone is making 75,300 or less, that would allow you to be eligible for a ConnectorCare plan. In 2026, there is an income range that is between 15,629 to 62,600, and that is for an individual. As another example, if you were a family of four, for this year, the income limit for a family of four is anyone making $156,000 or below. Beginning in January, the income range for a family of four is $32,150 to $128,600. Now, I realize I'm throwing a lot of figures at you. What I want to communicate is that all of this information, all of these slides will be available to you following today's webinar. We'll be sending you all of this information so you can spend some time looking at this information more closely and thinking what this means for your particular situation. Now, as you can see here, ConnectorCare, we are keeping, or we will still have in place, ConnectorCare Plan Type 2A, 2B, 3A, 3B, and 3C. And in every plan type, there is a lowest cost premium. So anyone who is eligible for a plan type 2A has the option of enrolling in a $0 plan. Plan type 2B, if you're eligible for that plan type, the lowest cost plan is $53 beginning in January, and so on, going into plan year 26. Now, you might be wondering, you've heard me talk about FPL or the federal poverty level. Essentially, these are income limits that are established outside of the Health Connector, but through the federal government, that we have to use in order to help categorize or place people into different eligibility groups for health insurance plans. So if you want to just take a moment and look at the slide, I know some of you might be looking at this information for yourself, or you may be thinking about yourself and family members. So just as an example, if you are a household size of three, so I'm just going to start on the left-hand side and I find, the number three. And let's say my estimated income for next year is about $61,000. It looks like you could be eligible, depending on how everything shakes out. You may be eligible for a ConnectorCare Plan Type 3A. Now, as I said, I know these are a lot of facts and figures, but my colleague Melissa is going to step through some examples when she goes through her demo, and she'll specifically show you how that information can apply. Now, once you can put in an application, or if you update your application, you're going to be at a point where you want to begin your shopping. And there are different things people need to consider when shopping, and that can help you control your costs as you're going through this process. Typically, individuals look right at the premium to start, and the premium, a monthly premium, is the amount that you're required to pay in order to enroll in the plan. Now, covered benefits, these are all of the services that are covered from each of the health insurance plans. And then there are additional out-of-pocket costs, so the amount a member pays at each service. So as an example, if you need to see a specialist, or you need to go to physical therapy, or even pick up some medication, there likely is an amount that you're going to pay in addition to your monthly premium, but essentially a copay or dollars towards your deductible that are out-of-pocket costs that you want to consider. In addition, there are network preferences that people have. So depending on your own circumstances, there may be certain doctors, specialists, or hospitals that you have a relationship with that you either want to or need to maintain. So we want you to be able to look at all of this information so when you're shopping, so that you can make the best decision for yourself and your family. So in order to make those decisions, we have a number of online tools that are available. So I'm going to step through each of these, but know that my colleague Melissa is actually going to do a demonstration of each of these. The first tool is our Get an Estimate tool, and it lets people see right before even submitting an application what plans are available in your area. So by entering simply your zip code and some basic other household information, you can get a sense of the plans that are available, the costs of each of those plans, if you in fact qualify for any advanced premium tax credit, and then what the monthly premium, so what is your expense each month to enroll in that plan? So that is our Get an Estimate tool. That's available from our homepage, and Melissa is going to take you through that. In addition to that, we have a plan comparison tool, and this lets you dive a little bit deeper. So as an example, if you went through the Get an Estimate tool and you said, okay, I'm interested in figuring out if plan XYZ or plan ABC. Those two seem like the amount that I can pay. Let me find out. I can go to the plan comparison tool now and find out if my doctors or my hospital or the health center that I go to, are they contracted with plan XYZ and plan ABC? In the plan comparison tool that Melissa will take us through can show you that. Now, we call out this last tool here, Plan Finder, because once you do complete an application, those that get an estimate tool and that plan comparison tool basically get combined. And based on your exact information of your household, your income, your eligibility, you're going to be able to search for your health insurance plan as well as your any providers or facilities, and you're going to see the exact cost to you. So that is only available when you're in your application. So that is after you have completed an application. And if you are on you're on your computer right now and you're like, well, let me fool around. I want to see, I want to look at these tools. You can go to mahealthconnector.org/renew. That's our webpage for open enrollment. And that's, you can go there as a new applicant or an existing member, and you can practice using these tools to see, what is available and what the cost might be. Now, when you have gone through the application, you found out what your eligibility is, you found out whether or not you're eligible for any advanced premium tax credits, then you need to pick a plan. So once you've chosen the plan that you want to enroll in, your enrollment in that plan isn't complete until the premium gets received and processed from us. So as an example, if somebody wanted coverage to start on February 1, they need to enroll in and pay for coverage by January 23rd. If you are looking to either enroll in coverage for January 1, your deadline for enrollment and payment is December 23rd. Now, if you're an existing member and you get a bill for a premium that you weren't expecting and you're like, oh, is there still time? Just remember that you have time to change your plan up until January 23rd. Okay, open enrollment runs from now. It started on November 1st and will end on January 23rd. On this slide, we're just showing you a sample bill so you can get a sense of what they look like. And note that there are a couple of different ways that you can make a premium payment. First of all, I want to acknowledge that you do not need to receive a paper bill. If you don't want it, you can choose paperless. You can make a payment online through the payment center. You could make a payment through the mail. You also have an option to pay over the phone. So again, a variety of ways to make a payment, and stress that you do not need to receive these paper documents. They are all available to you if you choose to go paperless. All of these documents, any notice that we send you is available online through your portal. All right. Now, I know we've been sharing a lot of information. You may be wondering, how can I get help with this process? I've come to this webinar. I want to understand more about health insurance coverage. Maybe you've even taken a stat or stats. You've been in your application, you've updated things, but you still want some more assistance. I want you to know that there's free help available across Massachusetts. We have customer service as well as community partner organizations. For customer service, you can call 877-623-6765. We also have a TTY number for individuals who need it, 877-623-773. And if you are interested in knowing what our hours of operation are, generally they're 8 to 6 p.m. But during open enrollment, as we get closer to the payment deadline, we have extended hours on those Saturdays closer to open enrollment. So there is an extended Saturday in December as well as January. Now, if you are interested in a local event, we do have a website that lists some of those events. So it's www.mahealthconnector.org/events. Now, I want to just talk to you a little bit about community partners, just so you understand who these individuals are and how they can help you. These are individuals who are known as navigators or certified application counselors. They speak typically, we have individuals who speak languages in addition to English. So if depending on where you live in Massachusetts, you can find a local person who can help answer your questions about eligibility, application, plan, any questions you might have about this process overall. And if you need support in a language other than English, it's likely you'll be able to find that in your community. During open enrollment, we tend to be very busy. They tend to be very busy. So it's best to call ahead and make an appointment. And many of these organizations have evening and weekend appointments available. In addition, if you are in a position where you want some help, but you don't want to, or you cannot go to see them in person, you can also connect with them, make an appointment, and they do phone calls. They can, FaceTime with you, etc. There are lots of different ways that these community partners can speak with you and support you through this process. Now, some of you who are on today's call may be in a household that has one of you, closer to Medicare eligibility, or you might be making some transition maybe through the Health Connector to Medicare, etc. We wanted to just to call this out in case anyone needs this information. You can get support from a local Shine counselor by calling 800-243-4636. All right. So with that, I want to call on my colleague Melissa to see if she would like to join and then take over with the demo.
Awesome. Thank you so much, Nikki. Okay, I am going to demo an applicant who needs help and has a few questions. So this is a new ConnectorCare member, and we have some information here. So the member has a household of one. They are 36 years old. Their income is about 25,000 annually, and they live in Worcester, so the zip code is 01610. So they want to get an idea of, exactly how much a plan would cost and exactly how much they would be saving. So for this example, I will be demonstrating the Get an Estimate tool. The person also would like to know if their medication would be in network and if the facility that they go to would also be in network. So for the second demonstration, I'm going to show you if these two scenarios here, if it would be in network. So let me start by showing the Get an Estimate tool.
And Melissa, I just stopped my share, so I'll let you know when I can see your screen.
Perfect. Give me one quick second. Okay. So I'm going to share my screen. All right. Can you see that?
Now I can. Perfect.
Okay.
Thank you.
Perfect. This is my favorite part because we get to see exactly how much this member would be saving. So here we're at our homepage, and if you toggle to get an estimate, you'll have two examples here. We have individuals and families, and then the second one is businesses. So we want to click on individuals and families. And here we just want to enter some information regarding the member that I just went over. So we want to choose the coverage year, which is 2026. And then if you remember, this person provided a zip code, and I'm just going to enter it here, which is 01610. And then this member makes 25,000 for the year. It's only one member, so we just enter one. And this person is 36 years old. And then if you notice on the right, we have a few more options here. You just want to make sure that this person needs coverage is clicked on. And then we have two more categories. This person is pregnant and this person is disabled or blind. But for this example, we'll just say that this person needs coverage. So then we click on Go to Results. And then this is just a quick reminder that this isn't an application for health coverage, and that is fine. We just want to get an idea of cost and savings. So here we have a breakdown of the estimated eligibility for this member. So again, it's showing you that this member, person one, 36 years old, they are eligible for a ConnectorCare plan with advanced premium tax credit, which is great. So it looks like they are going to receive a tax credit in the amount of $410, which is wonderful. And they are eligible for silver plans with monthly premium as low as $53. So that is huge savings for this person. So we just want to get a further breakdown of the plans. So we click on Preview Plans. And just a quick reminder that this person here, it's a further breakdown. So the Connector Care plan type would be 2B. And we also get the federal poverty level for this person, and that's 159.74%. And then we also get the advanced premium tax credit for this person, which is again $410. And I just want to remind everyone that members are still eligible for the advanced premium tax credit. Certain people who fall under type 1 or 3D would be eligible for the enhanced premium tax credit. But for this example, it would not be enhanced. It would be the regular advanced premium tax credit. So we have a breakdown of the options available for this person, and then we see exactly how much they would be paying for each one. So just as an example, the first one is the Fallon Health, and it looks like the plan name would be the Standard Silver Community Care Connector High Silver Plan. So we take the monthly premium cost, which is 477.90. Then we subtract the advanced premium tax savings of 410. Then we subtract the Massachusetts state savings of 1490. And then we get the cost of what exactly this member would be paying per month. So that's just one example. We see that the members getting some good savings here, and that is wonderful. So then we have a couple options on the bottom. If you feel comfortable and now you want to go ahead and apply, you have that option here. You can just click on Apply Now. But if you wanted to start over for any reason, or you wanted to add some more numbers there, crunch some more numbers, you can start over. So this is just a great example of cost. All right, so then in the demo, I wanted to also show you how you can see and make sure that either your doctor or your medication or the facility that you go to is in network. So let's see. If we go to our help center, and then we just want to scroll down 3 times here to the Resource Download Center. And if I click on that, I can see that this is the Plan Finder tool. So this is exactly what I want to use. So I will click on that. And then let's see. This is the comparison tool for 2026. So let's continue. Okay, so now we have to enter a few information regarding the member. So the zip code is the zip code we used before, which is the 01610. And you do remember that this person was qualified for a Connector Care plan. So I'm going to click on yes for this question. And then we're going to say that this person qualified for a plan type 2 because that's what we saw in the previous example. And then we want to continue. So for this example, we don't have a doctor name, so we're just going to leave that blank and continue. But for here, we want to enter the facility. So this is the Family Health Center of Worcester. Oops. Sorry, guys. Okay. So I'm just going to click on Family Health Center of Worcester and we continue. And then this person has a medication that they use. It's an asthma medication, which is called Pulmicort. And we saw that in the example that was provided. So we have a drop down here, but what we want to choose is the exact dosage and strength for this member that we saw in our scenario. So we would pick this one here. They have a 90 MCG. So then we want to compare plans based off of this information. So now we see that this member has 7 plans available. And then we have a list of the plan. We have the drugs, the providers, and the facilities. So what you will see in this breakdown is that the medication, whether it's in network with the plan and whether the facility is in network with the plan. So this is very important when you're selecting a plan because you want to make sure that if you're continuing with your provider or your medication, whatever plan you select will be in network. So for this first example here, we see Fallon ConnectorCare 2. We see that the medication is actually in network. And then we see that the facility is in network. So this is just a helpful tool to help you guide you through the process of figuring out which plan would be best for you. So then we have here, we can start the tool over again if we have more information to add, or we can go back to our home page and I'm going to click on home. And then this will start the plan comparison tool all over again. But if you are saying, you know what, this is awesome, I want to go ahead and apply, you can click on the Health Connector, and this will bring you back to the home page. So yeah, this is super helpful in case you did not want to be committed to an application. It would basically give you a breakdown and an idea of what exactly you would be eligible for. Okay.
Thanks so much, Melissa. I'm sorry. Apologies for the delay. I was answering some questions. I feel like we've got lots of great questions, and I know the team's been doing a great job trying to keep up with them all. And it sounds like there are lots of unique scenarios out there. So we are going to do our best. If we're not able to answer your exact scenario, please, we're trying to synthesize and respond to as many things as many people in situations as possible in the next 15 minutes. So Nuri, if it's helpful to you, I can just talk a little bit about some of the ones I was able to respond to. Um, okay, great. So while Melissa was doing her demo, which was great, thank you. I was responding to a couple of individuals who were in situations where their income right now for 2025 is going to be really different or excuse me, their income in 2026 is going to be really different than what they made in 2025. So one person I responded to said they're taking a pay cut starting in the new year. So they weren't sure, like, what do they do? Like, is their eligibility going to be based on, is their eligibility going to be based on what they made this year, or how does this year impact next year? So essentially, if you're one of these individuals, you just need to know that shopping for coverage in 2026, if you think your income is going to be significantly reduced, or if your income is going to be zero, you can put that in. You can put in zero, you can put in a significantly reduced number from what you made in 2025. In plan year 2026, we're interested in what you are thinking you're going to make that year. So, as an example, you might be someone who says, you know what, I'm cutting back significantly, and I think I'm going to really be making like $15,000 to $20,000 next year. You can give that information to us. Let's say your situation changes in March. What you want to do is come back and update the application. So let's say you either increased your hours again, or you took on a new full-time position. You want to come back and report that change so that you can get the best plan that you qualify for and you don't have any unexpected tax penalty. Because remember, Thalia and I talked about, and Melissa, we all talked about advanced premium tax credits. Please, we want to stress, they're not all going away. What is at stake now are enhanced premium tax credits. That is what you're hearing a lot about in the media. But we do have a set of ConnectorCare plans still available for people who become eligible for a plan type 2B all the way up to 3C. Nuri, Thalia, any other, actually, Melissa, is there anything you'd add to what I said? Or Nuri, do you want to give me a couple of other scenarios of types of questions people are asking?
We're just getting a lot of questions about income types, and what'll be factored in their application and eligibility purposes. So I'm not sure if we can send out a list that basically indicates what folks should be reporting as part of their income, excuse me.
Yep, absolutely. So we do that with following every webinar because everyone has different circumstances. So some people might be thinking, okay, I've got rental property income do I need to include that? Is that not included? I have retirement income. How are these things different? We will give you a complete list of what is countable and what is not countable so that as you're going through, just look at that list and think about, okay, how does this apply to me? In addition, I know we're trying to give you general guidance on today's webinar, but you can contact a local assister or even customer service and ask your very specific question. Protecting your privacy is very important. So when you call customer service, they'll ask for permission to look at your account. And if you give them permission, they'll go right into your application with you and can help answer any of your specific questions and also make updates in your account. Melissa, is there anything you'd want to add there?
Yes, just that when you're going into the application, we have some helpful tools there. So if you have any question regarding exactly what is needed, sometimes you'll see it right there in the application. It kind of gives you a brief description. So look out for that if there's any confusion or questions. But yeah, definitely reach out to customer service if they're very specific and you don't see it in the application.
Right. Thank you for bringing that up. So we have tool tips. As you're stepping through each question, if you need more information about that particular question, or as we were talking about income types, you can link directly to information based on where you are in the application. Thank you for reminding me about that, Melissa.
Oh, yes, and one more thing too. If you're stuck, everything gets saved. So don't worry if you're stuck in a certain section and you need to call customer service, your information will still get saved.
Okay, great. They'll get saved and they'll be able to pick up wherever you leave off.
Yes.
And then just a reminder to folks too, that we will be sharing this recording and the presentation and links to how to access a local sister, etc. So for those of you who are asking for those resources, they will be shared with you via email.
Oh, and if you wanted to, if you want to look right now, if you go to our webpage, hold on one second. Let me see if I can just pull this up really quickly for you. So here, let me just grab this. Let me know if you're able to see this. Are folks seeing the Health Connectors website?
Yes.
Okay, great. So Melissa was taking you through the renew page, but if you just come to mahealthconnector.org, there is lots of great information. So the Get an Estimate tool is here near the toolbar. Help Center, you can find customer service details here. You can click to find local help right from the Help Center. So I'll just click on that for a second and show you. This help is free, everybody. It is available. People want to hear from you. So honestly, all you would have to do is type in a zip code here. And I want to say I'm looking for a navigator. I'm going to type in 02155. And you can see a number of different organizations are popping up over here. So we have Boston Public Health Commission, Cambridge Economic Opportunity Committee, and then there's more. I just have to click on I have to click on the button to see more, pardon me. But you can certainly try that out. All right, what are the questions? I got lots of questions or questions about proof, but go ahead, Nuri, I'll let you if you.
Yep, proofs and then specific questions about metallic tiers when it comes to plans. So I know that Melissa, the demo that you showed shows silver plans, etc. But I think that folks are interested in seeing beyond that.
Okay, great. So the demo that Melissa did showed results based on the information that she provided. So she plugged in a particular income range, and that income range returned those plans that were available to that individual. So you would want to essentially, when you're applying for coverage, if you don't qualify for a ConnectorCare plan, you will be able to see all of the different metallic tier plans. So you'll be able to see catastrophic plans, bronze plans, silver, gold, and platinum plans. I think one of the questions I also answered was related to plans that are HSA compatible. So beginning in 2026, the catastrophic plans and bronze plans, as well as any other plan that the carrier deemed as an HSA compatible plan will be available or will be compatible to use with this health savings account. So I hope that somewhat helped people who are asking about other metallic plans. And just should I try to explain metallic tier so that it makes a little bit more sense? Or is there something more pressing? Whatever you want.
If you can do it in 20 seconds before we move on to the next thing, I know we have just about 6 minutes left, so.
Okay, sure. If I could try in 20 seconds, and if Melissa, if there's anything you want to add. But essentially, all of the plans are grouped into categories by actuarial value. What the actuarial value or AV really means is the percentage of the plan, the percentage of the costs of all the services that either the carrier will pay or you, the consumer, will pay. So if you enroll in a platinum plan, you are paying more out of pocket upfront. And then if you use those services, when you use those services, you are paying less at point of service. The reverse is also true. If you enroll in a lower cost bronze plan, if you don't need many services, you know you don't get sick, you're not planning to go to the hospital for anything. Again, this is none of us have a crystal ball, but if you're looking ahead and saying, no, I think I can enroll in a lower cost monthly premium, but at point of service, when you go to either pick up medication or if you need to do a particular thing, like get an X-ray or an MRI, you will be paying more for those services. I know I took more than a minute. I'm sorry.
Thank you, Nikki. And I do want to offer you and Melissa, or Talia, the opportunity to we shared a lot of information today. If you could just summarize, right, briefly explain what it is that people need to do today, by when, etc., just in a nutshell, that would be helpful.
Melissa, could I ask you to go first?
Yes, definitely. Definitely, if you need any help, just reach out to us at any time. We're here to help you with any questions. We have so many resources online that can also help you through the entire process. Don't feel overwhelmed. We are here for you.
Thank you. You always make me feel better, so that's why I wanted you to go first. Um, I want to think about something Balia showed you all, which is basically the chart. And you will get this PowerPoint presentation. You will see a chart. So we're here for you, whether you are someone who is newly applying or you are an existing member. If you are newly applying, you can go through this process on your own, online. If you get stuck at any point along the way, don't worry. Customer service as well as free certified help is available to help you. If you are an existing member, remember you do not need to recreate your whole application. You just need to go into your account, look at it, make any updates. If you've received your final eligibility notice and everything is fine, nothing needs to be changed, and you want to stay with the plan you're currently in, you don't need to do anything. You will be automatically enrolled in that plan beginning in January. However, we truly encourage everyone, because there have been so many policy changes and other types of changes, we really encourage you to go into your account, look at your information, and just make sure there haven't been any updates that you want to report, so that if there is more APTC available for you or any eligibility change, you have that opportunity to make those updates before January 1. So, Thalia, I'll pass it on to you.
Sorry, guys. I am in the trenches of question and answer. I would just say I've seen a couple questions about navigators. I very much suggest going to a navigator. I know that they're super busy, but we also have CACs available. So I think CACs are a good resource for people who probably don't need as much help with the application process or uploading documents. They are still available to assist you. I think that is a good resource to have. I know navigators are super busy. People are not able to get appointments with them sometimes. So customer service, navigators, and last resort chats are also available.
Thank you all, and I'll just share the customer service number for those of you who might not have easy access to it. Recognizing that we do still have several open questions in the Q&A. We thank you for your question. We'll do our best to sort through them and provide helpful links, resources in our follow-up email. But again, I'll just share the customer service number at this moment before we log off, and that is 1-877-623-6765. That is the Health Connector customer service line. And again, we'll share other resources. I will note that a lot of people are asking about changes in 2026. I know that this is very unprecedented times, but we share the information that we have at this moment, and we just ask everyone to remain informed and access the resources available to you online, in person, or over the phone. So Recognizing that it is 1 p.m. now, I just want to say thank you all for joining today's presentation from the Health Connector, where we shared, again, as much information as possible with you about our open enrollment period. So, thank you very much.